Everybody, good evening. You're very welcome. You're here with us with Let's Talk Equine for the March edition, and really appreciate your company this evening. I'm very pleased to be joined this evening by both Kirsty McCann and Ian Rountree, both of ARKequine over in County Kildare. So, guys, you're very welcome, and thank you so much for giving up your time to be with us this evening.
Thanks so much, Wendy.
Yeah, appreciate it. And Ian would just check in that we're still hearing you there as well.
Perfect, Wendy. Delighted to be here.
Super, guys, super. So look, just I suppose for audience benefit this evening, the topic is clearing the air. So really, I suppose we're getting into the nuts and bolts of respiratory issues, and I suppose, examples thereof, but as much as that, kind of what's behind the reason for them being there in the first place, and a little bit of the management and the supportive care of the horses that are enduring these conditions. So that's what we're about this evening. But I guess even before we get anywhere near that, maybe just to kind of introduce yourselves. I don't know which you'd like me to come to first. I always say ladies first, so maybe I'll come to Kirsty to begin. And maybe if you could just give us a little bit of an insight into, I suppose, what you do and what way you're trained, and what your kind of area of expertise is in that regard. Yeah.
Thanks, Wendy. Yeah, so my name is Kirsty McCann and I'm the manager of ARKequine. Originally, after a short career in racing, I worked as a veterinary nurse. So I'm qualified as a veterinary nurse. I worked in practice for 10 years in, at the time, probably the largest equine practice in the country in Anglesey Lodge, and worked under some great vets there. So really got a good all-round education in veterinary, and we used to cover a huge amount of respiratory cases while I was in practice. So a lot of respiratory cases on the medicine side, but also the surgical side. So this is an area that I've lots of experience with and a bit of a passion for educating people on as well, because it is that one area where you can really help to make a difference with a horse. Now my job is all around nutrition and healthcare. So ARKequine is a nutrition and healthcare company. So what we do is we provide a service as well as products as well. But tonight we're here to talk on the education side, and we're delighted to be here.
Well, you're most welcome and appreciate you giving up your time. And Ian, over to you. What's your day to day, and what's your background? And I suppose, give people a little bit of a sense of where your interest areas lie.
I'm a graduate of UCD, 2010. God, it sounds so long ago when you say it out loud, so it does. But
I won't say my year of graduate.
We won't ask those questions, so we won't.
There you go.
But I spent 12 years in practice before joining Forte Healthcare in 2022. So Forte Healthcare is the parent company of ARKequine, and I am a veterinary technical advisor for Forte, and through that I do a lot of work with ARKequine and with Kirsty as well. So I do a lot of advice, and I kind of would say myself and Kirsty we battle back and forth over some things, and we definitely we like to provide lots of education through our ARKequine forum. So we do as well. So it's definitely, we're delighted to be here to talk through all things respiratory health this evening. So we are.
Yeah, we'll appreciate that. So I do. And I suppose, like when you think about it, I guess, well, when I think about it, assumably you're across lots of different areas of equine health, not just respiratory. But if you were to kind of even think in terms of ballparking, like what proportion of, say, instances actually sit in this sphere of respiratory health as against maybe other aspects of what you do?
A lot. And we're getting more understanding around the causes of poor performance, especially in high performance animals, and it all or nearly always boils back down to respiratory health in some form. The lungs, the respiratory system are so vital to a horse's athletic ability that if it's impaired at all, it has a knock-on effect. So, it's something that we deal with nearly on a daily basis at this stage, and especially at certain times of the year. Last year, we saw outbreaks of, problems to do with oilseed rape. and we were flat out at that period of time helping trainers and that. So because a lot of our business is in thoroughbred, respiratory health is a huge part. I would say, you know, it's as high an instance rate as we would have talking to people about like gastric ulcers, you know, so it's very, very prevalent.
And when one thinks about it, and I know we'll get into this, or I surmise we'll get into this, shall we say, over the course of the next hour. So, you know, when you think about the power that there actually is to be preventative about so much of this as well, too, that's actually the scary part of what you've just said, isn't it?
Yeah, like it's the area that we can see the quickest return on our investment, if you like. And by investment, our time and what we do to change the management that we have of these horses that are affected by problems with the respiratory system. So it's a very rewarding area in some respects. And I don't want to make that sound like as if I love hearing people have problems about respiratory health, but at least it's an area that we do understand really well, and the research that's even coming out now about it is very comprehensive. So we do have lots of options that we can do, and you know, some of them are very simple and straightforward, some of them are a little bit more complex, but there is a lot that your vet and your, you know, nutritionist and things like that can work together, and it's that area that you can really have that synergy between your vet and a company like ourselves to help you.
And I appreciate that, you know, what you're saying is that you work a lot with people with thoroughbreds and, you know, people that have horses that I suppose are in training and whatnot. But I guess, you know, with the kind of understanding as well that a lot of the audience here on this particular platform has a tendency towards, we'll say, breeding, that early production, and tend to be sport horse people as well too. Not exclusively, but probably more so. Ian, like obviously, you know, I suppose my thinking a little bit would be, you know, when you are somebody that is in the seat of breeding and you have, you know, foals and growing young stock and that as well, like those formative years, they're so important, aren't they, for the building blocks for later on in life in so many facets, whether that is in skeletal health or, as we speak of this evening, in terms of respiratory health. What would your viewpoint or your comment be on that?
The lungs are really the engine of the horse. I mean, like we, you know, if they're not breathing properly, or if you're not getting enough oxygen in, you're just not going to be able to perform at all. So I mean, that reigns true from your, like, from right down from foals right through to your breeding mares. So it does. So I think it's something that should never be overlooked, respiratory health. And certainly there's so much, as Kirsty says, there's so much we can do in terms of preventative care. So there is definitely to optimize actually respiratory health, that you're not developing problems. We obviously are aware of lots of problems that are out there, but because of things we can do, and certainly in some cases, they're actually just simple steps. So they are. And we're going to touch on some of them later on this evening. So we are definitely in through the course of our talk. But yeah, there's just little things, little changes that can actually just completely change how, we'll say, you know, a horse can breathe. And it is like our lung capacity is tiny in comparison to a horse's. I mean, a horse has such a massive lung capacity. I mean, at rest, when we talk about the anatomy of a horse, we'll see that, I mean, a horse at rest only takes maybe somewhere between 8 and 12 breaths per minute. Whereas when they're up on intense exercise, if you're looking at a horse galloping across country, they could be taking somewhere up to on 100, 120 breaths per minute. So, I mean, if you get damage to lungs or respiratory system at an early age, that could potentially influence performance way down the line, something you may not even think of actually in such a young age.
Well, why don't we maybe get started? If you want to fix up your screen share there, Ian, and let's set sail and see where the night takes us, as they say.
So this evening, we are going to delve into the intricate world of the equine respiratory system. We've already introduced ourselves, so we won't bear or dwell too long on that, so we won't. We're going to look at a brief overview of the anatomy and the mechanics involved with the respiratory system before we discuss some of the common issues, diagnostic treatments and tools that are available to us, and then finally we'll finish off with some of the management strategies that are available that you can actually do to maybe minimize or potentially prevent the development of any issues. To kick off this evening, then, we're going to start with looking at some of the anatomy involved. Involved in this section, what we will do is we're just going to break it down into 3 key areas. So to start off, we're going to look at the mechanics of breathing, in particular, the inspiration and expiration, and how this actually may be affected by exercise itself. Then we'll move on to the anatomy itself of the respiratory system, and finally, the process of gas exchange within the lungs. So basically, mechanics of breathing involves, quite simply, the act of inspiration and expiration, or rather, breathing in and out. In horses, we know that the mechanics of breathing are quite different when we compare the horse to the process of at rest versus at exercise. And actually, this is also very different when we look at the horse in kind of the gaits of walk and trot versus canter and gallop. At rest, it's a relatively passive process that doesn't involve much in the way of effort from the animal. Respiratory rates, as we already said earlier, are in the region of 8 to 14 breaths per minute and are typically calm and regular. However, as they engage in a form of exercise, the mechanics involved in this process changes somewhat. If we look at light exercise, for example, such as walking or trotting, the demand for oxygen is moderately increased. The horse's respiratory rate and depth of breathing may increase slightly compared to rest. We may see an increase of somewhere between 12 to 20 breaths per minute. It won't go up dramatically, but it will increase somewhat. The diaphragm contracts somewhat more vigorously, enlarging the thoracic cavity to allow for increased air intake. And then when we get to the expiration phase during light exercise, it's generally active, but not as forceful as we would see during intense exercise. The abdominal muscles and the internal intercostal muscles may contract to help to expel the air out of the lungs, and expiration is still controlled and efficient, but it does not require as much muscular effort as we'd see during intense exercise. When we look at intense exercise, we tend to refer to cantering and galloping. And what we're looking at there is basically the demand for oxygen dramatically increases due to the higher metabolic rate of working muscles. So you're seeing oxygen demand has gone up, and you're going to see an increase even in carbon dioxide being produced as well. The horse's respiratory rate and depth of breathing increases substantially to meet this increased oxygen demand. And as a result, you get massive contractions from the diaphragm, which contract forcefully and rapidly, expanding the thoracic cavity to allow for maximum air intake. So you're increasing hugely to try and increase or maximize the potential oxygen that's coming in. During expiration phase then, it's vigorous and forceful. The abdominal muscles and internal intercostal muscles contract forcefully to compress the abdominal contents and push the diaphragm upwards. This action reduces the thoracic cavity and actually will say forcefully expel air out through the respiratory tract. And what we know is, and what we'll see then as horses are exercising, what you'll see and what you find is that at those higher rates, such as cantering and galloping, they'll match their stride to the respiratory rate. So you'll get actually a ratio of 1-to-1. So for every stride the horse takes, they will actually take a breath. And normally what you'll see is that's actually, it coincides with, as they canter or gallop, they inhale in suspension and they exhale when their first foreleg hits the ground. So it's quite an interesting in terms of, we'll say, that's where you see if a horse goes up to 120 breaths per minute, they're actually taking about 120 strides per minute at that, so in full tilt. And that's why we can see, and as we'll say, we already talked about briefly, it's so important that we are in good respiratory health for the mechanics to actually work very, very well. Second set of this section then is we look at the anatomy, respiratory anatomy. So horses, as we know, they're obligate nasal breathers. They cannot breathe through their mouths. They're very unique in that sense. And thus, there's this kind of, what's they saying, where they goes, the nose is for breathing, the mouth is for eating. The horse is the absolute epitome of that. So they are. When we refer to the respiratory anatomy, we actually start from the nose. So the nostrils are the first point of contact. So they are. The nares, it's the external cartilage of the nostril. And what we see is that this includes the nasal passages, which are separated by the nasal septum. So you have your left and right nasal cavity and the paired paranasal sinuses, guttural pouches, and the nasopharynx. That's their whole upper respiratory tract. So it is. When you move back further, we get back into the larynx, and we'll touch on that in a second. But the larynx tends to be what we refer to as the midpoint. It kind of separates the upper respiratory tract from the lower respiratory tract and is at the top of the trachea. Nasal breathing, it allows for efficient filtering. So they will filter air. You get humidification. They'll actually warm the air slightly before it reaches the lungs. And what this actually does is it helps to protect the respiratory tract from any heavy particles that may be inhaled, pathogens, and environmental irritants as well. So it is. As I mentioned, the larynx then is the second most important part of the respiratory tract. It's, as we talked about, the midpoint. Here you've got quite a detailed function here in general. It's made up of loads of cartilages, and where we have here, it serves as the dividing mark between the upper and lower respiratory tract. The anatomy of the horse includes several cartilages, muscles, and as well as that, other structures. To start with, you've got the thyroid and cricoid cartilages, which provide structural support and protection for the internal components of the larynx. Then the arytenoid cartilages are these guys here. And what they do, they are paired pyramid-shaped cartilages located at the back of the larynx. They play a crucial role in controlling the movement of the vocal cords and regulating airflow. So this is very important when we talk about one of the physical abnormalities that we see quite regularly in terms of, let's say, respiratory conditions, things like laryngeal hemiplasia, which we would often diagnose as a roaring in a horse. And we'll touch on that a little bit later on, so we will, but that is certainly very important in terms of the anatomy structures here. The vocal cords are responsible, we'll say, along with the epiglottis, for protecting the airways. And when a horse swallows, they will flip up the epiglottis to protect the airway and stop anything from actually entering into the airways. The vocal cords will also close, but it's also very important. If you imagine being at galloping, this airway should open fully and provide minimal resistance to airflow so that you're getting maximal intake. So we should, in that case, very, very important that these are all functioning as they should. And obviously, there's a lot going on in this case, so there is. Finally, then, we've got the thyrohyoid and cricothyroid muscles. These provide movement and tension of the vocal cords, and it's controlled by these guys there, so it is. The trachea then begins at the larynx, travels down the neck and into the thorax. Within the thorax, the trachea divides into two tubes, the chief bronchi, each having, we'll go back here for a sec, the chief bronchi further divide and subdivide within the lungs. These tubes become narrower and narrower and are referred to as the first as bronchi, then bronchioles. And ultimately, they narrow into and they terminate as alveoli. The alveoli are tiny little sacs located at the end of the bronchioles where the gas exchange actually occurs. Classic example, I suppose when we'd be looking at a descriptive term, you'd imagine as those alveoli are like bunches of grapes. And where you've got, they're covered in little capillaries, and that's particularly where your gas exchange happens, so it is.
Just in relation to, that slide that just was there in terms of the anatomy there, like, we so often have conversations around, I suppose, the external conformation of the horse and the genetic correlations there. Are there genetic correlations to the good anatomy here and the use of this anatomy here?
I see Kirsty laughing there, so I do. So
look, yeah,
I can't see any video screens at the moment. I'm blank here at this end.
I would say from personal experience, yes, there is genetic component to this, especially, and again, we can thank thoroughbreds for a lot of things and a lot of knowledge we get from them, because we do investigate this with them quite extensively. And there are certain family bloodlines that would be more prevalent with producing problems in relation to wind and, the anatomy of the larynx. You've got a really good example there on the right-hand side of the screen of a very high-functioning larynx where it's opening really, really well. And to see that is a lovely, lovely thing to see, because more often than not, when you're scoping these horses after they've galloped or whatever, you mightn't see that level of abduction of the two arytenoids. But yeah, I do think there is a genetic component in it, definitely. And I would be a massive advocate for breeding out of mares who are sound of their wind, and by stallions who are sound of their wind. I think
it's one of those things, certainly, that if you select to breed from an animal who has a problem, you obviously are more likely to breed a problem, if that makes sense. I mean, and I think that would ring true for anything with genetics, really. I think if you're, as Kirsty said, if you're selecting an animal who is really, really good wind, same as you'd say really, really good conformation externally, you would be hoping to breed something that has really, really good conformation as a consequence. So I think there's nothing to say that you won't potentially have a problem, but I think, you know, the chances of having a problem, if you took both parents that maybe had an issue with particularly, let's say, a laryngeal hemiplegia where this isn't abducted at all. So instead of having this lovely open space, you'll have this vocal cord is sitting right midway across there. And I think if you had both parents potentially with a problem, the chance of breeding an offspring that is prone to developing an issue is going to be quite high. It's not to say that they'll be born with a problem, but certainly I would say the risk of them developing something down the line, particularly if they entered into something, I would say probably more so eventing or high-end show jumping, where they're under more intense vigorous exercise, they could potentially develop something down the line.
Yeah, good. So
yeah, like it's not to say there isn't, and I'd say I'd agree with Kirsty and say more than likely there is a genetic link.
Thanks.
So if we move onto gas exchange. So gas exchange, basically what we have, the primary function of the lungs is to deliver oxygen into the body and remove carbon dioxide. Carbon dioxide is the primary waste product. So it needs to be blown off the lungs. So it does. Gas exchange, it takes place, as we already said, within the alveoli. And here the oxygen in the inspired air diffuses across the extremely thin walls of the alveoli into the bloodstream. There are millions of alveoli in the equine lung, and each is wrapped with a tiny bed of thin-walled blood vessels called capillaries. Now, as we'll touch on a little bit later on, these capillaries are so thin-walled that they can potentially rupture and, we'll say, cause a little bleed into the lung cavity, so they can. The driving factor for gas exchange essentially is a diffusion or a concentration gradient. Since the blood that is pumped into the lungs is low in oxygen and a high amount of oxygen is present in the alveoli, the oxygen simply flows from an area of high oxygen concentration to an area of low oxygen concentration. And then the opposite is true for carbon dioxide. There are high concentrations of carbon dioxide in blood pumped to the lungs, but there are only low concentrations in the alveoli. So we're getting rid of all that carbon dioxide, and then we're getting lovely oxygenated blood in the lungs, which is then pumped back to the left atrium of the heart and is subsequently circulated throughout the body to oxygenate oxygen-dependent tissues, which is very, very important for skeletal muscle. So when you're exercising, and you know, it's to help, I won't say it'll stop, but it certainly helps rapid production of lactic acid, so it will, and real kind of, we'll say, muscle breakdown and deterioration. So we'll say the function, your lungs working really, really well in combination with your cardiovascular system are very, very important for your fit and competition horses, so they are. Some of the common issues and risk factors that we kind of just identified for tonight's conversation, as we've already discussed and kind of touched on, some of the physical abnormalities here. So the first one here you'll see on the left-hand side is what we've already hinted to and kind of alluded to, which is left laryngeal paralysis. And what we mean by that, you might often hear people refer to left laryngeal hemiplegia. And it typically occurs on the left side, mainly due to an anatomical phenomenon, whereby the nerve supply loops around the aortic arch. So basically loops around the base of the heart on its path to the larynx. Now, the right-hand side, on the other hand, basically has a really short direction and route, doesn't come in contact with any problems, and hence it's not prone to stretching or getting damaged or anything like that. We can grade these on a scale of 1 to 4, and it's typically dependent on the degree of paralysis that we see. Horses that present with this physical abnormality are typically referred to as roarers or roaring, and it's because that vocal fold is unable to pull away to open up the airway fully. And as we can see in this picture, the vocal fold on the left-hand side is not opening nearly at all to increase the size of that airway, compared to if we went back a couple of slides previously, and you've got that lovely, nice open windpipe. Kirsty, you probably have seen loads of these in your time in nursing?
Yeah, so you'd either typically see the really, really bad ones, which is like that. So even at rest, you've got that the arytenoid has fallen in. Or what you'd see is the ones that after you've maybe lunged them or exercised them and then you scope them, they just can't stay open and they're just start flutter down. And it's that kind of shaky fluttering down. And then depending on the severity of it, like a horse like that who's permanently got the arytenoid isn't functioning, you're looking at something called a tieback procedure, which is where they physically tie it up out of the way. Now that has other considerations. Remember what you said about the fact that the epiglottis flips up to cover the airway so the food doesn't go down and things like that. So we have to be careful when we start tying up the structures of the larynx, that from a management point of view, we are being considerate of that. So feeding from ground level, not feeding where they're able to, like hay nets are a nightmare because their head is up. It's all acting against the way you want the larynx to work. And then those ones that are just quivering, it may just be a simple Hobday procedure, which has been around for donkey's years, where they will remove the vocal cord and you know, take some of the extra tissue out there, and that will open up the airway enough. And I suppose where you've got roars, you also have whistlers as well, which is probably that one that you will hear when you're exercising, where you've got that whistling noise. And they're generally the ones that are just a little bit shaky as opposed to the full-on roars. So yeah, you there's a lot of them. You'd see a lot of them. And the management.
Like if you're in any of our breeders who are on tonight, when you be doing maybe you're getting your vettings done for the likes of your Cavan sales or your Gores Bridge, you'd often see your vets doing working them in a tight circle. And they're getting their wind up because they're actually trying to hear for some of these kind of, say, as Kirsty describes, the whistling or the roaring conditions. They're trying to hear for some of those things. And then the absence, I suppose, of doing an endoscope, that's what you're essentially looking for. So it is really in those respects.
Yeah, you can't get away from the fact that a person's ear is fantastic. It's probably the best diagnostic tool out there, and it's the cheapest. So you know, it's the lunging exam, whether it's your sport horse sales or your thoroughbred sales, that is your first point of the wind panel. And you know, and then as well as that, you'll often see if you're having a horse vetted, the vet will actually palpate that area to see if there's any scars, to see was there any previous wind surgery in that area. So yeah.
Atrophy as well, like you might get a little bit, we'll say, like it might be a little bit abnormal compared to, as you say, a little bit of scar tissue or atrophy compared to the other side.
And that's like, again, coming back to, you know, the breeding scenario and where somebody maybe is purchasing a mare, you know, to breed from in the future. Like you want to know that, you want to have that information. And just like, you know, you mentioned there Hobdays and tiebacks and, you know, the others like typhoid, but like what are the, I suppose, degree of success with one over another, or the degree of complication with one over another of those type of procedures?
There are statistics. I don't have them to hand, but Hobdays are quite effective. We've kind of progressed on how we do them. We can now do them with lasers. We can do them standing. We used to have to knock them. You know, so they are very effective. A lot of very good horses will have been Hobdayed. And then with tiebacks, they are very effective, but management is more of an issue with those guys. Once the Hobday is done, if it's a surgical Hobday where they've gone in, it's just underneath the throat that there's a small incision, it's an open wound, it's left to drain, they close up incredibly quickly, and you have very little issue with it because it's free draining. With a tie back, which is what you do for a more paralyzed horse, you have higher risk of surgical complications. So, you know, you can have wound incisional complications where you can have seromas develop, and which is where you get a pocket of fluid in there. So recovery from surgery can sometimes be a challenge. But generally we've got very good procedures in place within our surgical establishments, and they're kind of at a minimum, but they do happen. And then, like I said, trying to keep that airway healthy, because you have altered the makeup of that larynx, you have to be mindful of that and how you manage that horse going forward. So I would often have, and this is kind of a very common one that I would come across, where maybe I've got people who've gotten horses out of like training and they're racehorse to riding horses now. And they'll tell me, oh, my horse coughs an awful lot, and whenever he has a hay net. And you'd inevitably go out and have a look at the horse and have a feel of it. And you'd be like, well, has it had a wind surgery? They go, oh, actually, no, it has. Well, okay, let's just make a small adjustment. Let's feed them from ground level. Let's help them out a little bit. And the cough tends to go away. So, if you have no complications, they can be extremely effective. There's a number of very, very good horses who've had surgeries like this. But yeah, so I'd say higher complication risk with a more intense surgery like the tie back over the hot day.
And just whichever view, like, I suppose I appreciate that we're talking in this scenario here about adult horses and physical abnormalities, but if we bring it back to the newborn foal just arrived in the world, and when we think about like anatomical issues at that point, I suppose we're more, well, I'm inclined to think about soft palate, and like, just maybe would one of you maybe give a little bit of a thought on the issues at that point when foal has just arrived on the ground, and with regard breathing issues potentially at that point, or aspiration of milk into the lungs and things like that.
I think definitely when you've got a newborn foal, if you see milk coming out its nose, you have to be mindful of possible cleft palate. And that's more kind of what you'd be concerned about with a newborn baby. I would have, been with vets where it would have been common to scope foals for the sales. And they're very, very small, very soft larynxes, and you have to be quite mindful. They'll flip their palates really, really readily because there's a scope in there. Doesn't mean that they have dorsal displacement of the palate or anything like that. It's just that they have an immature larynx that doesn't really have much strength to it at that stage in their life. But that would be slightly later. So with regard to newborn foals, cleft palate would be my first thing I'd be concerned about. So I would be very mindful in those first couple of sessions of nursing that I'll be making sure that the milk is not coming back out the nose or a possibility of aspiration.
That's the key indicator for a breeder. Yeah. Super, thank you.
One of these alluded to there would say that the second most common physical abnormality we would tend to see would be dorsal displacement of the soft palate. So you can see here, if we compare the image on the left, you've got a lovely outline of the epiglottis, where compared to here, we actually can't see the epiglottis at all. What would basically happen is, and we've got a little video clip here, so we have, and what you can see is, if it plays,
it's playing,
is that during exercise, what can happen is the soft palate flips over the epiglottis. Now, you'll often see that horses will actually produce a gurgling sound, and they'll completely drop off their performance. It's generally a complete characteristic of poor performance in these, let's say, race horses, probably the most common ones you see it with. You may see it also, obviously, in any animals who are really at intense exercise, such as your eventers and things like that as well. In those conditions, yes, typically, like you're talking about, surgical correction, a tie forward or something to that effect. So it would be to correct that kind of condition.
Just for people who aren't maybe as familiar with looking at this nature video as you are, can you explain to them kind of like what exactly you're looking at here?
Okay, so this video was taken by placing a dynamic or overground scope up the horse's nose, and it was actually exercised. This horse was a racehorse. She was a 2-year-old filly who was in training. She was galloped in as close to racing conditions as you can get. So she was one that had a history of cutting out in her pieces of work and that. So she'd be traveling away really, really well. And then the jockeys were describing her as just kind of going out like a light, like she'd hit a wall. So the decision was made to do a dynamic endoscope. So this is her a full gallop, and you can see there she's displaced her palate. So she's retroflexed her epiglottis. And what happens then is you get this billowing of the soft palate, and that essentially closes the airway for a period of time. It's all very quick because she's galloping. So remember what Ian was saying about one breath a stride, that's what she's doing there. It actually closes the airway, and it's an extremely extremely scary moment for a horse, because basically it's like as if they've just been cut off of their oxygen supply. And that's a
Oxygen supply,
really
absolutely.
video, because just before she does it, she also collapses her AE folds as well. So she has two problems going on there. Now, I'm delighted to say she's since had a tie forward procedure, which is basically bringing the pala forward and having it in such a way that it makes it much more difficult for that epiglottis to flip in. And she's actually since ran and has ran very well. So yeah, so hopefully, fingers crossed, that was a successful surgery. But yeah, it's a very good video. It takes a couple of times to watch it if you've never watched one before. But when you see it and you see her flip, you'll also see the airway kind of close all of a sudden, and that's her oxygen supply is cut off. So it's quite a significant thing to happen.
And I suppose, you know, as much as you're talking about, I suppose high performance thoroughbreds here, like the same impact can be at play in terms of the performance ability for those that are at the high end of jumping.
Oh, absolutely. There's, you know, the hospitals around the country they'll do a lot of thoroughbred work, but they'll also do an awful lot of dynamic or overground scopes on sport horses. There's actually a vet in Belgium who will jump horses in scopes to see what's happening when they're jumping. So yeah, so it does happen quite a bit with sport horses as well, that they'll have this diagnostic test done. It's just this one happened to be a really, really good example to show. So
it's not a condition that is unique to racehorses. It's probably just something that is more prevalent because they're at that more
being tested at that
intense. They're being like really their respiratory system is being pushed constantly. So it is. So I suppose that's where you're seeing a little bit more in terms of that. So it is. But certainly, I mean, if you imagine, particularly your adventures nowadays that are, would say, going hell for leather over, you know, whatever it is, like 20 odd 30 fences, you know, they could be prone to that. They would certainly be pushing that respiratory system, that they could absolutely be, if they had a weakness there, they could 100% develop something like this. So they could. Some other things then we just kind of would say kind of highlighted for this evening then as well. Some things that are common are the likes of your equine asthmas, your recurrent airway obstruction, and what we already touched upon, just your exercise-induced pulmonary hemorrhage. So equine asthma, essentially you're talking about an inflammatory airway disease, quite similar in its occurrence to humans. Realistically, it's basically what we talk about, a hypersensitivity in the lungs to certain airborne allergens such as dust or mold. We definitely saw quite a bit of this in the last year in terms of actually an asthma reaction to really your rapeseed oil. So it was in particular back in the early part of last summer when we actually had a good summer. But something like that, I mean, in retrospect with, I suppose, your rapeseed oil has actually very heavy pollen, which is actually, it's not even windborne, it's spread via, it's vector-borne. So it's not actually, for a horse to be affected, they couldn't be miles away from fields of rapeseed oil. They'd actually have to be in quite close proximity to it. But it was a very heavy pollen. And what you'll find is that horses affected actually produce lots and lots of mucus in response to this. And as a result, you're getting a closed off airway. So you're getting an inflammatory response, which closes off the airway and makes it really, really restrictive to breathe. We'll come on to later on, which is some of the, I suppose, the treatment techniques in terms of, we'll say, actually treating something like that. And what you'll find then is with recurrent airway obstruction, it's what we would have classically referred to as COPD or heaves. So you'll get the development, as you can see here on the left, it kind of heaves line in a lot of cases. It's a chronic issue, as COPD would suggest. And you'll often get where this heave line is producing or is actually developing is behind or below the last rib. And it arises or develops because of an increased abdominal effort associated with breathing. And that even occurs at rest, so it does. So particularly with this condition and to a degree, I suppose, equine asthma, there's an awful lot of management things that we can do to kind of help either prevent or certainly minimize the effects that we see in our horses with those things. Exercise-induced pulmonary hemorrhage, on the other hand, then obviously, as the name suggests, it occurs at or during intense exercise. So you'll often find, I suppose, the most common time this may be diagnosed will be after maybe an event, or we'll say jumping or racing, where you'll get maybe bleeding from one nostril or both nostrils. Horses may be scoped to identify the cause of this, and you may often find that there's bleeding onto the lungs. And it's those little capillaries that we mentioned in terms of the gas exchange are actually rupturing during, we'll say, this intense period of exercise. And it's because there's so much pressure happening that those tiny thin wall vessels actually just burst or just pop. They can obviously affect performance, so they can, but it'll just depend on the individual horse. I'm sure there's plenty of cases where actually EIPH has been diagnosed as almost like not a red herring, but inconsequentially, just when a horse is being scoped, it may not have affected performance at all, but it's certainly been present after a race, or as we say, a competition or something like that. So it's.
Yeah, we've seen very high profile examples of that as well too, I suppose, in show jumping sport as well of recent time too. So I think people would be reasonably familiar with it.
It's certainly a big problem, and I think, like we say, any time you're talking about the lungs being really put under stress, there is the potential for that to happen, for that to develop. But certainly, I think there are hopefully things maybe coming down the line that might show some improvement or some. There's certainly it's a key area of research for a lot of people, so it is at the moment.
And before you move on, Darren, just again to remind and reiterate to you know, our audience this evening, please do submit your own questions. We'd love to have them. We'd love to hear what your curiosities are. But and I know we're coming to the management side of this, which probably will be where people's intrigue will be. But in terms of equine asthma as well, Darren, like, you know, I suppose that's one that, like, it doesn't make choices between the nature of the beast as such, in the sense that this can as easily be affecting, you know, your kid's pony right the way through to your, you know, your high performance athlete. It doesn't make choices in that regard. Yeah.
No, absolutely. I mean, your lead rein or your first ridden pony is just as likely to develop asthma versus, you know, your FEI show jumper.
And it can be very debilitating, can't it?
Of course. I mean, I suppose depending on the extent to which it develops, like that mucus production can literally close off and wall off airways. It's no different to, I suppose, you can have various degrees of humans who are affected, or humans are affected to various degrees with asthma. Horses are the exact same. You can have very mild forms, and you can have extreme opposites to that. And then obviously when we talk about our COPD, it's just our more chronic kind of our more seen in adult horses. And it's just, we'll say, one of those that kind of develops for a longer period of time.
There is a question in here in terms of the strapping of the mouth, or I suppose also that maybe the use of tight, you know, different drop nose bands and whatnot. How much of a difference does that make to respiratory effort, in your opinion?
So cross nose bands or flash nose bands are actually encouraged if you've got a palatial instability. So what it does is it creates a seal in the lips so that you don't get that turbulent air coming in through any gaps in the mouth and then causing any further palatial instability. So if you've had a horse that's had any surgical management of a palate issue, they will always be recommended then to work in a cross or a flash nose band after that. So
thanks.
In terms of just the general anatomy of that area, unless you are sewing a noseband onto a horse, like, you're not going to restrict that airway at all. So you're not realistically, you're not going to say it's the ability. The only thing that will restrict the airflow into a horse's nose is the ability to flare those nostrils up. I mean, would I be right in saying that now, Kirsty? You would say, like, there wouldn't be, like, you're not going to massively impinge. Like, you'll often see, I suppose, eventers who have the flare nasal strips and stuff like that. So they have.
Yeah. No, like, I would wonder when you've got some of those bridles that you sometimes see where you've got a very low drop nose band on them, whether or not you could potentially restrict the top of the nostril from having full use of an opening. But I suppose it's kind of in relation as well to how much work they're doing. So if it's a horse that's up at intense exercise and galloping and needing the full extent of its lung capacity for that, or whether it's a horse doing a dressage test, it's probably all relevant as well.
Okay. Thank you. I think we should maybe move on, looking at the clock as well here.
And just to point out, I suppose, that not every nasal discharge we see is connected to a respiratory issue. So the biggest thing to note is that horses' teeth are actually what we call hypsodont teeth. So they're open-rooted. And what you can find is sometimes you get a tooth root abscess that can actually be discharging into the parent or into the sinuses and could actually be developing as a nasal discharge, particularly if it's only coming from one nose. So it is just to note, and it's just as a bit of an aside, just to say that not every time you see nasal discharge will it be just linked to respiratory problems.
And a very crude and effective way of figuring out if it's tooth root abscess is smell it, because they tend to be quite pungent. So don't be afraid to get your nose in there and see it.
Kirsty.
Sorry? Yeah. It's a very crude one and a basic one, but it is effective.
Some of the diagnostic tests then we would look at in terms of, I suppose, with our respiratory workups and trying to diagnose problems are, as we've already alluded to, and Kirsty's touched upon already, is the endoscopy. This would have developed initially, just as you can see in this picture, just at rest, may have been performed after initial kind of, we'll say, exercise. But now you've had the development of obviously treadmill-based assessments and over the bridle assessments as well, or what we would call over ground assessments, which have really kind of opened up the ability to actually see as a horse is performing. So you could have a horse who's jumping, who's going cross country, and who's performing the dressage test, and you can actually pop these cameras on. Once they tolerate them well, you can actually then see what is that upper respiratory tract or upper respiratory airways, what are they actually doing at the time, and is there a problem developing? So you can actually see, and you can put them under that kind of competition almost scenario and see why are we resulting in poor performance and where is there an issue there. Some then of the things we can do with these are we can take some samples using bronchoalveolar lavage. And that's where we actually inject some fluid onto the lung. So it's taking a sample really far down at the level of the alveoli. And normally this can be done either blind or through the scope. And we'll say a sample is injected through and basically aspirated back up. This sample will typically only be sent for cytology because you will normally get maybe a little bit of that's not generally considered a suitable sample for culture in these cases, whereas a transtracheal aspiration or a transtracheal wash is better sample for a culture. And what we mean by culture, essentially you're taking a sample, you're sending it off to the lab to be plated up to see if bacteria will grow, and as a result then you can decide if there's antibiotics warranted and what may be required or anything like that. The TTW or the TTA can be performed in two ways. It can be performed by either passing through a scope, or you can actually go transcutaneous. And this is basically where you go blind, you just go through, you palpate through the individual cartilage rings, and they just go into, we'll say, the airway that way, inject some sterile solution, and then aspirate it back up pretty quickly as well. So they do.
And that's probably if you have a foal where you've got some sort of respiratory condition with them, maybe they've got pneumonia or whatever, it'd be a TTA that the vet would perform on them. As opposed to the BAL. The BAL is much more suited to your bigger, full, your adult animals or your older young stock.
And can there be any complications as a result of the latter?
No, they tend to tolerate them very well. If you're doing the BAL, some local anesthetic is also introduced so you don't get them coughing. You go in, you generally are able to aspirate back as much as you've put in, but yeah, they cope very well with it. And then with the foals, it's very quick. It's not too invasive. Bit of local anesthetic in the skin, and the hole is minor. It closes up itself. There's no real concern on it.
So just leading on to some of the, I suppose, risk factors, prevention strategies that we have, I suppose, in these guys. Kirsty, we're going to throw over to you.
Yeah. So this is where the vet and the practical side of things kind of we mix it up a little bit. So I'd be more on the practical end of things, and Ian does all of our academic veterinary side, which is brilliant. So we're going to talk a little bit about environment, nutrition, and lifestyle. Environment is a key contributing factor to respiratory health. It's an environment means everything. So it means everything from the bedding to the environment that the animal is living in, to stable design. I have to say, and a shout out to Teagasc on this one, they have an excellent article on their website around stable design and ventilation and how to design your stables. And what I would say is, if anybody is considering building any new stables, do spend a little bit of time looking into ventilation and stable design, because you can prevent an awful lot of problems by having a well ventilated stable. What we're trying to do is achieve 6 air transfers per hour, so every 10 minutes, to ensure that we're clearing that air and having constant clear air in that vicinity. I would work an awful lot with yards where maybe people have inherited stables or they're very old stables, and people are always terrified I'm going to walk in and tell them to start knocking holes in their walls and stuff like that. It's we try not to do that. Sometimes we do have to knock holes, but essentially what we want to do with stable design is we want to ensure hot air rises and that it has a method of escape. So making sure that we've got ventilation across the highest point in our stables is incredibly important. And then what we want to do is we want cold air to come in from the sides. So as the hot air rises, the cold air falls and it drives everything up. Now, when it dries everything up, it's driving everything, pathogens, ammonia, the whole lot. So it's very important if you're looking at ventilation at the sides and at the very, very top. But I would urge everyone to have a look at that article with Teagasc. It's very good. I looked at 2. I looked at that one and one from Penn State in America, and they both said the exact same thing. So that's great. Have a look at that. When we look at bedding, what we're looking at trying to achieve is that our horses are comfortable, they've got clean bedding that's very absorbent, and that we're able to muck it out somewhat easily, I suppose. And I know things like deep littering and stuff like that is becoming more and more common. And I also know, and I'm very aware of the shortage of straw in the country at the moment. So people are looking at alternatives as well. And paper bedding is a very clean alternative. Cardboard bedding, I've actually seen egg cartons being used as bedding. So shredded egg cartons being used as bedding. So there's lots of different options there. But the main thing is that whatever bedding we're using, we want it to be free from molds, yeast, and aspergillus to as close as we can get it. So you'll find when you go into your feed stores or wherever you buy your shavings, you'll see dust extracted shavings. They're all great. They're all brilliant. The one thing I would say is the most important thing is when you're putting down fresh bedding in your stable is make sure your horse isn't in it, because there will be a certain amount of dust rise out of the bedding that you've got or from disturbing the bedding that's already in the stable. So always try and bed down when your horse is not in the stable where possible, So I think
that goes as well, Kirsty, for sweeping and using blowers and all of that shabago as well too. And even
blowers should be banned from inside stables as far as I'm concerned. I know they have a place, but when you're in an American barn, blowers are a disaster because they're just blowing the dust and everything around the atmosphere, and it's just irritating to horses. So if you are doing it, try and do it when they're not in the stables.
Well, and get them. Any human that suffers with allergies or asthmatic conditions would have the utmost of empathy for any horse that is imprisoned, should we say, in an environment whereby it cannot escape from these irritants.
100%. So yeah, very important that when we are managing our day-to-day lives around our yards, that we are mindful of if we are sweeping or if we are, pushing dust or creating dust and having it rise, that we try and keep our horses out of the line of that. And please, where possible, don't use blowers inside American barns, because they really do just aggravate the air and rise everything up.
Well, all you have to do is go in on a sunny day and see the streams of sunlight coming through and just look at what's floating,
Yeah.
You can see it then.
Absolutely. Turnout is hugely important. I don't think it's ever going to stop raining. You know, the land is extremely wet at the moment, and I know it's not always possible to get horses out, especially at this time of year. But where possible, turnout is hugely important, and even turnout into all weather arenas is great just for their lungs, especially if you have horses that suffer from equine asthma. It is really important that they get out of their stables and out into an open air environment. Okay.
I suppose with that said, I suppose it's also being cognizant not having, if they are irritated, you know, easily, with the mindfulness of what you've mentioned already around the oilseed rape as well too. And you know, I suppose there are some animals that you know, they find irritants outside as well as inside, shall we say?
Yeah, absolutely.
And I guess you know, I suppose I think as well too, with regard to, you know, when you mentioned stable design and that as well, and I often think people can be very you know, sort of mindful of labor and mindful of time, expense on jobs and all of that, and then one of the outcomes of that is that the manure pit is stuck right up against the stables. And, you know, again, you're taking contaminants out of the environment and irritants out of the environment, and then they're right outside to come back in again.
Yeah, having your muck heap, your manure pit at a adequate distance away from the stables is very important, and not up against an adjacent wall to the stables, because the ammonia just being produced in the muck heap will irritate the airway as well. So if we move on from bedding to probably one of the hottest topics around respiratory health, and that is around hay or haylage, and what we feed our horses. What we're quite encouraging, what we encourage our owners to do is we encourage them to do forage analysis. And we work closely with the Equine Centre and run all our samples through those guys. And forage analysis can comprise of three main aspects. So one is your nutritional analysis, one is your mineral content, and the other then is your hygiene. And your hygiene is looking at molds, yeast, and aspergillus and seeing what's present on that sample. And this was quite an interesting sample in that it had a 3 versions of aspergillus on it, which is virtually unheard of, to the point where we rang them and said, is that correct? We've never seen 3 of them on one sample before, and it's very rare that you would get all 3. And each one of those on their own can be detrimental to a horse's respiratory health, but when you get all 3 of them together, it's a disaster. And there's certain cut-off limits. So, you know, while we always aim to have a perfectly clean hay sample, it's not always possible. So what we look at then is we look at what's the probability of this sample or this batch of hay causing an issue. So quite a low CFU per gram is manageable, and there's certain things that you can do to hay to actually manage that further through soaking and steaming. But when you get a combination like this of 3 different aspergillus in it, we would straight up advise not to feed that.
And
that would be
in relation to the numbers on these analysis sheets, like what are you looking for in terms of the safe ranges, shall we say?
We looked into that. Was it below 500?
Ideally, you want 0. I mean, that's the ideal. You want a nice clean sample, but certainly if your combined numbers are above 2,000, it's not a brilliant sample. It's not detrimental completely. But then if, as Kirsty said, if you're looking at 2 or more, particularly of this, you've got, we'll say 2, 3 aspergillus species present. That in itself, when we contacted Alan and the Equine Centre, they just said, listen, this is not a great one at all. So it's not for that, unfortunately. The lower the number, the better, unfortunately. Absolutely. The CFU is basically colony forming units, and it's done per gram. So that is, so we'll say if you look at the top number there, where it's Aspergillus niger, it's 1,500 colony forming units per gram. That's an awful lot. So it is, I mean, that's on a very small level. That's a huge number. So it is.
And I suppose the other thing that I was going to say in relation to this, I think oftentimes, you know, the approach is people are buying in hay, and, you know, or them even maybe making their own hay, and the decision is made to have it tested when it is initially saved, but then can kind of forget or dismiss or maybe not think to
critical, I suppose, with all of these. I mean, it's all well and good, as you say, getting it tested initially, but actually if you're not feeding it for 6 months maybe or so, it'd actually be more important to get it retested or even leave off testing nearly to that point. Obviously, if you had a very poor hay sample when it's made, you'd try obviously not to maybe go buy a whole big pile of it. But certainly if you have a good hay sample when you've bought it, your storage conditions need to be optimal then, so you're not actually inducing the growth of any of these kind of fungi, yeast or molds, because that can obviously happen. And then if you're unaware, you could potentially be feeding, a really high pathogenic load to your mares and even to your foals.
And just like with this particular sample there that you mentioned that the danger point with 3 aspergillus, like what would your expectations be in terms of negative outcomes for the horses ingesting this?
This sample was taken following a number of horses bleeding, so having episodes of EIPH after not huge, hugely intense pieces of work. So we kind of knew that there was an issue in the yard. So then you go, common things are common, and you start looking at what are they taking in on a daily basis. And when we tested it and we got this result, we were quite confident this was the contributing factor that was tipping the horses into this state. So we removed the supply, we replaced it, we retested and made sure that it was a clean supply, and the problem pretty much rectified itself within a month, which was fantastic. So it's a combination of the person in the yard being very, very diligent and being able to say, well, more than 1 or 2 of my horses having this problem, there's obviously something driving it. So let's look a little bit further into it. But I will say that if anybody has any queries on their forage, do get in touch with the Equine Centre. They provide a phenomenal service. And they're Alan and his team in there are great. And it's money extremely well spent, I have to say. And that doesn't just go for hygiene. I will do an awful lot of forage analysis on stud farms, because I will be the person who pushes the good quality forage over the feed. Because if you've got a good quality hay or haylage, it will do an awful lot for your broodmare as your basis for your diet, and you're not trying to chase it. And it's the most economic way of feeding.
And, just as you mentioned, the broodmare again, the negative connotations for broodmares ingesting these kind of pathogenic fungi, it's not a great thing to be doing either in that circumstance.
No, you don't want to be creating any inflammation. And essentially, when you feed something that has this level of pathogenic fungi on it, you are going to induce a state of inflammation. And you just don't want to do that with your broodmares. You don't want to do it with any horse. But your broodmares, especially when they're in late gestation and then young foals, you don't want this in their environment either, getting into their lungs. So.
And just on this particular sample, again, being that you put it up there, like from your memory, were there any negative physical signs to the sample?
No, it was
the smell or visual or anything.
Yeah, no, and it was apart from that, it was actually a lovely sample. All right, the protein possibly, you would see higher sometimes, but in general, it was a lovely sample. I was shocked that I got those results on it, to be fair. Sometimes you'll look at hay or you look at haylage and you'll see the white on it, or you'll see the blue or the green or the black on it, and you'll be able to say, yeah, I know, I don't even need to send this to the lab. I know what I'm going to get back here. But no, sometimes it would shock you. Some of the best samples you'd pick up and physically look at, the figures and the numbers come back, and it can be your problem.
I think this one in particular actually was a bit of a shock, because I actually remember Kirsty saying that at the time, that the sample itself, you 100% would have thought like, look, this is really, really good kind of haylage sample, and you weren't expecting any of these kind of results at all. So I know someone had asked that question there in the box there, was there anything to do with smell or texture? And I think honestly, I'd say from memory, if memory serves me right, I think this sample, literally you'd be kind of buying it by the bag load, to think, you know, it's brilliant, it's perfect. So it's certainly, yeah, this instance, it was a shock, and it does absolutely show the value of, you know, spending a little bit of money with the equine center and getting this done, you know, just to double check that what you're feeding, particularly look at it, and that goes for any of sport horse, thoroughbreds, and particularly I would say absolutely your breeding mares when they're coming into your late gestation or early lactation. You want to be feeding really, really good quality forage.
Yeah, absolutely.
Okay. So lifestyle can have a contributing factor on respiratory health, and probably one of the areas that I talk an awful lot about is traveling horses. Now, in Ireland, we're in a position where we don't tend to travel for long periods of time like they would on the continent. But, you know, I am very conscious that you've got an awful lot of sport horse people who maybe are traveling onto the continent, and they would have their animals on lorries or in 2 boxes for a period of time longer than maybe a couple of hours that you would if you're just traveling up and down the country here, or if you were going to stud with your mares or whatever. So one of the areas that we would speak an awful lot about is around shipping fever. So shipping fever is a situation where you've got an animal that's traveling for a period of time. They will spike a temperature. And it occurs because they're unable to clear mucus out of their lungs. So they essentially get very sick very quickly. And anybody who has horses that travel large distances and has done over the past, they've probably come up against shipping fever. What I tend to do when I'm dealing with people who are traveling horses, I ask, can they give them an extra big space and maybe not tie them up? You know, because you're not restricting the head in an upward position. They're able to get their head down. They're able to clear out their nasal passages. They're able to clear out their lungs. It's quite important for them. But if that's not possible and you do have them tied up, it's extremely important that you stop at regular intervals, get them off the box and let them get their head down. And that is hugely important if you're talking about traveling young stock and foals as well, especially. So if they're traveling a long distance, making sure that they're not stuck on a box for a long period of time is important. And then we do get good weather every now and then in Ireland. And, you know, going to shows, especially if we are in the middle of a heat wave or whatever over here, making sure you've got enough ventilation in the box, making sure the windows are open, if you can get the ramp down, if you can get the front part of your horse box open, just to get that airflow through, and keeping good air circulating is hugely important. Okay. If you've got
to have their heads up for long periods of time, really, like, so not like if you think of a horse in the wild, she spends so much of the time grazing, the head is in that lateral low position, and I mean it is, as Kirsty says, it's that elevated position where they're not dropping their head enough. That's what's really developing and kind of predisposing them to that problem of kind of shipping fever and developing those issues.
Yeah, but even going back to your asthmatics and like any of these respiratory kind of situations, I guess, you know, would I be right in saying that you would be encouraging people to try and feed from the floor as opposed to, you know, heads up into hay racks and hay nets, and having a clean space on the floor that they're being fed as well too, and keeping that breathing sort of
I can tolerate hay nets because they can be at a level. And there's good, you know, reason sometimes to do hay nets if you've got, you know, horses who eat too quickly, or you want to slow them down, or, you know, various things. Hay racks, in my opinion, and I might be in the minority, should all be taken out of stables and dumped, because it is completely unnatural for a horse to be head up in the air eating. Just think about all that dust, small spore particles, everything going down into the lungs. I don't like them. I get rid of them if I see them. It's just much more natural, as Ian said, for horses to have their heads down.
There's little kind of, we'll say, brush-like projections on the trachea that basically, it's what we call the mucociliary escalator. And that will actually work much more effectively if the horse's head is naturally in a down position. So if they're foraging down, like if you have your horse out of grass, they're going to eat, we'll say, head down for up to 17 hours a day. So I mean, like if you have a horse that's feeding this way the whole time, that actual anatomical phenomenon can't actually work properly because it's trying to go. It's like the contenders trying to go up the gladiator escalator at the end of the whatever, at the end of the competition. They're trying to go up. Whereas if you naturally just project it downwards, this can actually clear any of those, we'll say, little particles and pathogens that are developed, and you can actually really help in the management of those things, like your asthmas and things like that.
Now, the only one that I have to say that you don't feed from the ground is any horses that have had typhoid operations, because you have altered the larynx. By them putting their heads down, you end up stretching the prosthesis, those two stitches that have gone in. So those horses are fed at chest height. So they won't actually be allowed to turn. There's no turnout for grazing for those for a period of months until the sutures and everything is settled. So yeah, they'd be the only ones now that I will back down, but I still wouldn't put the hay rack up for them.
And what,
Kirsty, you're still feeding at, I would say, a chest height. So you're still feeding almost at that kind of level,
yeah,
where the head is still kind of, we'll say, almost horizontal.
Yeah.
It's just not in that kind of, we'll say, vertical position, really.
Yeah. And while I think to ask it as well too, the opinions in relation to those who feed full round bales where animals are like literally sticking their heads into bales. Do you know what I'm saying?
Yeah, no, I do. Yeah, it's probably not great for them from a respiratory point of view. I know that you've got, personally, I don't use them. I do feed hay out in my paddocks during the winter, and I spread it along the hedge line, so they still have their heads down. Yeah, I couldn't hand on heart say I've seen a huge amount of problems from round bale feeders, but
okay.
Yeah,
Okay.
I probably dislike them for other reasons, of foals getting caught up in them and stuff. But yeah, no, I'd much rather spread the hay out on the ground.
That's okay. Yeah.
So intense exercise regimes can have a strain. Basically, we're taking animals from a natural state where they graze and they live happily on the sides of hills and in fields. And then we take them and we put them into work and we put them under strain, and we create an environment where, they're more susceptible to things happening and affecting them. So if you've got high performance horses traveling to shows every week, being put on and off a lorry, being put into different stable environments, maybe they're going away for overnight shows, we're putting more strain on them, and then through intense work. So we have to be mindful of that as well. So the more workload, the more traveling, the more stress, the more strain, more oxidative stress that they're under, the more chances you have of having an inflammatory process going on. And that's where we can help with nutrition and things like anti-inflammatory properties within our ingredients and stuff like that. So it's always mindful just to think, well, and that's not to say our ponies that are out in the field don't get COPD and are really badly affected by it. But if you take that pony out of the field and put a saddle on it and send the kid off to go for a gallop on it, it's going to be a lot worse. So, it's all relative as well. And then a short note on vaccination and making sure that you are vaccinating and keeping to the vaccination scheduling is really, really important, not just for the health of your animal, but for the health of other animals as well. Because, there's lots of talk around the likes of EHV and stuff like that, and being responsible and making sure that your own horse's vaccination status is incredibly important, especially when you're putting your horse in another person's environment where there's other horses.
I know we can all be very familiar with acronyms, those of us that do know them, but just to, I suppose, maybe explain to people, I suppose when you're talking vaccination, you're talking your regular flu vaccination, and you're also, after mentioning there, equine herpes virus, and potentially, I suppose, discussing that with your vet in relation to risk scenario for a particular farm, and the kind of stock you have and the amount of movement and so forth that you're doing, and whether it's
exactly
yeah,
and whether in a breeding environment, whether you've got a closed herd, whether you're introducing new mares to it, is the risk very high if you've got 5 brood mares which are all being artificially inseminated and never leave the farm, and you know, don't have anything else coming in, how at risk are they compared to if you have a yard where maybe you've got a few brood mares and a couple of competition horses who are heading off every weekend jumping. Then,
or even just that you've got the one family member that's disappearing every weekend during the hunting season and coming back in again into the yard, or bringing animals home from sales, or whatever the risk may be. But to discuss those individual circumstances, I suppose.
And just as a brief outline, Ian has the vaccination schedule there.
Yeah, I mean, we're talking, I suppose, like, it's, as everyone will know, even in terms of COVID-19 vaccines, the vaccine is never going to be 100%, but the more of the cohort and the more of the national herd that is vaccinated, the less disease we will see with these things. So what we found, like what you'll see is that basically with flu vaccine, with the equine influenza, you're getting 2 vaccines as a primary course, which are given at least 3 weeks apart, but no more than 13 weeks apart. And then after that, you give a first booster between 5 to 7 months after the second vaccine, and then you're given annual boosters thereafter that. So it's important, not even just in your competition horses, but certainly in your brood mares, to keep those vaccines up to date and to keep your records of those vaccines. As we say, in general, it's not that you're going to particularly overly prevent, but certainly if an infection came onto your yard, and you should find that your animals are then actually more capable and more built to, you know, fight off those infections and not really succumb to significant disease or infection or anything like that.
Okay.
So the final, or it's not even the final section, I apologize, the second last section of our talk this evening is just some treatment options that are available. And loads, and there are various treatment options available. And what you're really talking about, I suppose, really is in terms of, it depends on what is actually going on with your animal. It may be a case of you may require veterinary intervention, and it could be a thing of, in terms of, I suppose, if your vet is coming out, as we already discussed, you may be talking about doing cultures and sensitivities if you're looking at something like a bronchopneumonia. And the reason those things are done are really so that you're picking and selecting for the most suitable antibiotic, so that you can give the shortest duration course possible, and it's going to be the most effective, so you're going to get the quickest resolution. It also means, and I suppose why these tests are done, are so that we're not selecting for resistant antibiotics, and it's reducing resistance down the line. There's this whole campaign out there at the moment. It's the One Health approach, where we're really trying to not use antibiotics that are solely, or trying to keep a lot of antibiotics really for human medicine, rather than just trying to create or creating resistance with them. So there is a lot of first-line antibiotics that are available, yet by doing culture and sensitivity, we can pick and select for the most appropriate in those instances. What you'll see here then, you've got, we'll say you've got a nebulizer in effect, and sometimes you'll often get, particularly in the likes of your equine asthmas and stuff like that, you will often get things like dexamethasone and clenbuterol or ventipulmin can be used in these instances. Where you'll find, I suppose, nebulization is essentially, it's a process whereby a liquid is transformed into a cloud of very fine particles and is inhaled by the horse. It's achieved with this guy here, and basically what it consists of is a mask with a motor that transforms that liquid into particles. The particles are suspended in the air, and the horse actually just naturally inhales them in. They're a great piece of kit because you're getting a really targeted approach to the area, and you're not really having to, not saying that vets won't still do systemic treatments, but you're not getting systemic effects maybe from prolonged or overused steroids treatment particularly. And you can get much more targeted approach, so you can. In terms of then some of the forage and supplements, this is Kirsty's element here.
Yeah, I'll be super quick. So we've spoken at length about quality of hay and haylage, and the importance of testing it to see what your supply is like. And I will reiterate again, that's not just in relation to hygiene, but having a good quality hay with good digestible energy will save you money in the long run on hard feed. And I'm happy to talk to anybody who wants to talk about the breeding stock and their hay quality and diets and stuff, because honestly, if you've got a good balanced hay or haylage, it's the best thing that you could have in your stud farm. We look at steaming and we look at soaking and we look at the differences between the two. And traditionally we would have soaked hay, and most commonly we would soak hay for our laminitics. because we want to remove those water-soluble carbohydrates and reduce the sugars. You can soak hay, and it can be somewhat effective with regard to dust. But if you want to have a really clean hay, and you have a hay that has a known problem, or has a certain level of bacteria load in it, steaming is much more effective, and that will reduce and give you a clean forage to feed your animal. There's lots of different steamers on the market. They are expensive, but they're an investment, I will say that. This one here has 360-degree steaming, so it's steaming not just from the bottom to the top, it's steaming from the top to the bottom and from the bottom to the top. So the penetration on it is excellent. Steaming, it's done through a process of, it's basically a kettle in a box, really. You're producing steam through a kettle. It's being dispersed into the unit. It disperses around the hay. It creates a temperature for a period of time, and that's what basically kills the bacteria. It's that simple. From a palatability point of view, steamed hay is extremely, extremely palatable. We don't tend to steam haylage. It just kind of goes against the fact that haylage has a much higher water content, and doesn't tend to have the same dust problems as our hays do. Now, sometimes we've got this new kind of wrapped hay, which is kind of, is it a hay, is it a haylage? And I even open them sometimes, and I'm like looking at it going, is it a hay, is it a haylage? Be one or the other, from my point of view, when I'm doing diet plans, it's much easier if it's one or the other. There is options out there. If your hay is not hygienically perfect, there is options that you can do to help it, be it steaming or soaking. If you're soaking from a hygiene point of view, you only need to soak for about 15 to 30 minutes. That's all. Okay.
And it's an important thing maybe as well for people is that, it's soak or steam and feed, not soak, steam, leave lying around and all the rest of it.
And one thing I will say is, if you are soaking for a laminitic, ensure that you hang up that hay net and you spray it and you let it drain off. So you basically wash all that sugary water off of it. Otherwise, you've just made a very, very sweet meal for your horse. That's not going to do a huge amount for your problem. Okay, so that's just a quick note on forage. And then supplements they're a minefield of everything that's present, or what can you use. There's certain things that I feel are very, very important. Omega-3 is incredibly important, and that's not just for respiratory health, but we're in a very unique position now where an awful lot of research is coming out around omega-3 and the benefits of it. So omega-3 has anti-inflammatory properties. We look to feed an oil to provide omega-3. The best omega-3 providing oils are actually marine derived. So your algal oils over the likes of your flaxseed oil. Now, flaxseed oil is fine, but if you're getting down to, if I'm using it for a respiratory problem, to help with that respiratory problem, the amount you have to feed is actually quite high to get the levels of omega-3 that you want to be giving. So looking for an oil that has a good omega-3/6 ratio, so more omega-3 than omega-6, because omega-6 is pro-inflammatory, and if you have more omega-6, you push the pro-inflammatory response within your animal. So having the balance right is very important. Now, omega-3, as it's an anti-inflammatory or has anti-inflammatory properties, it does help with any inflammation in the airway. It also has the added effect that the essential fatty acids are very important for red blood cells. And what it does is it makes the red blood cells incredibly elastic. So if we remember back to when Ian was talking about the tiny capillaries around the alveolar, that where you have essentially where you can have the bursting and the bleeding and then into the lungs. If you have red blood cells that are much more pliable and that can bend and flex more, then they are less at risk at tearing those capillaries, basically. So from the point of view of, you've got an animal who suffers from EIPH, I would make sure we've got a very high level of omega-3 going into the diet. There are various herbs out on the market that you can get, so everything from peppermint and eucalyptus, fennel oil, thyme, horehound, black cumin. What I would say to you is, when you are looking at any supplements, please just make sure they're coming from a reputable company, and make sure that they're good quality. make sure that you understand the label and it's very clear for the reason that you're using it. If I'm looking at a respiratory product, I will be looking for something that has a calming effect, maybe a soothing effect. And most importantly, I want a decongestant. So I want a mucolytic and an expectorant. So if there is mucus on the airway, that it's able to break up that mucus and get it up out of the airway. And this is where supplements are actually quite effective. And there are a number of them on the market that will do that job for you. You also want something that helps to support the immune system. So if you have a horse that's in a state of inflammation, their immune system is taking a bit of a battering essentially. So making sure that there's vitamin C in the diet, making sure that there's vitamin E. Now, horses generally aren't deficient in vitamin C, but if you do have a horse that's under an inflammatory challenge, I would look at making sure that I'd increase the amount of vitamin C going in. So antioxidants are very important. So your vitamin E as well to help support that animal. All right. Is that us done? Ian, is that?
It. We just will say have in terms of, we'll say just for any of our attendees tonight, if you go onto our website or if you scan the QR code, you will say you can avail of a 10% discount for the month of March.
Thank you, very kind. I'm sure people would appreciate that. If you want to let that sit there for a second and then come out of your screen share. Yeah, now I can see you again. That has not happened to me before, where I haven't been able to access the video panel throughout. It's a different seat to be in, but yeah, like you've touched on an awful lot of areas there. I know that, you know, I suppose in terms of, there was a question there from one attendee in relation to equine asthma and its relatedness to recurrent airway obstruction and whether one leads to another, or is the relationship there. Maybe if you want to tackle that, Roneen.
Yeah, I think certainly if you because sometimes you'll get something that will develop as just something that's mild to moderate. Some of those will be self-limiting and absolutely will just almost resolve of their own, or will resolve with some management changes. But yes, RAO or COPD essentially will start off as something mild, and it's the chronicity of it, so it develops over age. So essentially you will say that, I mean, COPD just doesn't develop overnight, or recurrent airway obstruction. It's not something that happens overnight. It is a chronic thing that we typically see in our older animals. And so it probably is, you will find that it may be recurrent episodes of equine asthma. It may not just be, oh, they developed equine asthma once and now they will develop COPD. It is something that probably will develop over time, but they may just not respond initially to your treatments for equine asthma. So that's why it's important to really get, if you do get a diagnosis of it, to actually start to really look at, as Kirsty's touched on, some of your environmental things and your environmental changes, because it's not always just, I suppose, a thing of, oh, it's something that always requires medicine. You do also get, if there is a condition, you can get summer-associated pastoral obstructive pulmonary disease, and that's when they're actually out of grass and they will get an allergen to just pollen that's out there. So it is, so like you think, grand, I'm having them out of grass, I shouldn't get a problem, but actually in those cases you nearly have to bring them back inside, which seems counterintuitive.
There's a great government website that tracks pollen and tree pollen, and you can actually split it up between tree pollen and crop pollen, and basically it does every 24 hours. I got obsessed with it during the summer last year. But yeah, no, but for some people where I knew we had horses that had equine asthma, I had them track it and take the horses in during the day and then put them out at nighttime. So you can be quite helpful to your animal. And sometimes with these equine asthma cases, sometimes the only answer is to let them live out, because everything irritates the airway. I have one trainer I work with who has a horse, and ammonia irritates his horse's airway, so he has to live out, and that's it. So
I suppose, like, the thing is, you know, I mean, in latter years more people have built barns as opposed to linear boxes and all of that, you know, and appreciatively, you know, we live in the climate that we live in, and there are reasons why people have done this, but at the same time, when you do have these candidates that are a bit more susceptible, then, you know, it's like changing things for that one horse when things are not changed for every other horse in the barn, then they're still exposed to the same situation, and even putting them in the end box isn't always going to be the the payback. But look at, like, you touched on so many different areas. I appreciate, like, there's always going to be bits where we don't get a chance to talk about in terms of a respiratory discussion, like things like strangles, or even rhodococcus equine foals and all the rest of it. There's lots of different areas. It's maybe food for thought for another session in the future.
Go back and do part 2.
Yeah, and I do appreciate that there have been a couple of people there have asked specific questions about products, and that, again, you gave your contact details there, and people are free to follow up with you in due course after this session. But yeah, like, I can't kind of echo enough what you have alluded to in terms of the value of hygiene and environment, and, like you said, Kirsty, like the stable structure to begin with, that there's good ventilation in play, like the respiratory system, as you said, Ian, the outside, like it's the engine, it's
a lot of people turn around and say, the feed is the most important thing, and the feed is the fuel. It's actually oxygen is the fuel. You can feed them.
Oxygen is the fuel for us all.
If their lungs aren't working, they're never, and that goes down, like, I was with a dressage rider today, and we were chatting, and they were saying that the horse was fatiguing in the longer tests. And it's actually all coming from a respiratory problem, because there's not enough oxygen getting in to oxygenate the muscles, and that's what's happening essentially. And I was there when she was riding today. I said, right, pull up, let him catch his breath and go back. And she was like, right, okay. So we were able to establish, right, when he gathers himself back up together and he can get enough oxygen in, then he can do what you want him to do. But we need to manage, and we need to condition his lungs, and we need to ensure that his lung capacity is at optimum. So we have to make a number of changes to his environment and to his feeding and his management to ensure that that is possible for them.
Yeah, and when you have the environment and all that bit in place, then it's about the sympathetic training then to to step them up gradually through their levels as well. Somebody here is very curious, Kirsty, what is the website that you have to track the pollen?
Google it. That's how I found it last year. What was it?
You can
literally I think I just Googled, like, and it was Monaghan I was looking for at the time, and I Googled pollen counts in Monaghan, and I just stumbled across this website, and then I was able to find everywhere in the country. I was really happy with myself. Sorry, what is it?
Pollen.ie.
There you go.
Pollen.ie. So simple.
Very simple. Yeah. But it was brilliant, because this particular yard was surrounded by conifer trees. So we were able to literally go, okay, and to the point where that horse did not get ridden at a certain period of the day, and it made a huge difference to it. So.
Yeah, and like, if you really want to dig into things, you can dig in and find another way to try and manage a situation. Yeah. But I suppose part of the message that I'm also taking from this evening from the outset was around, being mindful of, if you are in the scenario that you're breeding as well, being mindful of the genetic relationships there and setting things up to be on a good footing from that perspective. Appreciatively, conditions can be managed and they can be treated and there can be all these things, but at the same time, if we can avoid them being produced in the first place, well, that's a very good starting point. So guys, we have gone a little bit over time, but that's all right. And thank you so much for being with me.
Thank you so much.
Really
enjoyed it.
Appreciate it. And I hope our viewers likewise got something from it. And we will press the red button, the eject seat here, and say good night to you both, and good night to our viewers, and thanks everybody for sticking with us. Really appreciate it. And I'm back here, I cannot remember the date, I think it is the second Tuesday in April, but we'll be in touch.
Thank you so much.
Good night for now. Thanks guys, take care, bye bye.